So we're here today at Shrewsbury Livestock Market to offer some blood pressure checks. It's not just about the blood pressure check, that is really just a door opener. So I quite often say this, that it actually is a way to get the farming community to come to us and talk to us. It's surprising what comes through a conversation once you open the door. So what we tend to find then is they're actually needing to really signpost and refer the individual to support they need in the community. So the team have to build the trust and the relationship with the farming community, and that's what takes time. But we're regularly here, so we come here monthly. We go across all the other cattle markets and livestock markets in Shropshire. But for us, it's about actually, why are they not reaching that support that's out there already? Why can't they get to their GP appointments, or why can't they get a GP appointment when it works for them? They are less likely to have any form of help unless their leg's hanging off. So it's really trying to support around prevention and getting them to start thinking about, actually, what can I be doing before I get to that point of crisis?
We have the mobile hub with us, where the farmers can come into the hub and sit privately and have the blood pressure taken. We're likely to see up to 10, 15 farmers at each livestock market, so that's encouraging. And we do get quite a lot of new farmers coming, engaging with us. They sort of chat in the cafés, and they sort of said, "Oh yes, have you had your blood pressure checked today? You know, the girls are here, why don't you go?" And it's really good because they're sort of like opening up and encouraging each other in the community to take care of their own health. I met this gentleman at one of the livestock markets. He came and we did the blood pressure, and we found it was very high, and he was really surprised because he thought he was absolutely fine, and consequently he sort of took some medication to manage that now. So he's came back about 3 or 4 months later to tell me that that's what he'd done and the outcome. And he said he was really, really happy that he did take the blood pressure check in the end. I feel really grateful to be in this position. I know about the farming communities because I am a farmer's daughter, and I know how difficult it is to make them understand how important it is to take care of themselves. But I feel very emotional, actually. When he came to me and told me that, it's like, yes, actually, we are making a difference.
The programme we run has it's been in place now for about 3 years. And actually we were approached by a charity called Shropshire Rural Support, who are here with us today, and they said, what can the council do, what can public health do to support the farming community?
We have a 24-hour-a-day helpline, and we have a 24-hour-a-day text messaging service, and it's free and confidential. I visit all 6 livestock markets within Shropshire, and it's about being visible, it's about having a presence and being accessible for people. At market, it's a very low-key thing. I spend some time in the canteen, I wander around the rings, I spend time in the pens, just so people can see the badge, see that I'm visible, and they can come and talk to me. They can offload and get whatever's on their mind, off their mind, and we can find a solution together.
Farmers have quite isolated lifestyles. The average age of a farmer is 68, I think it is. So they don't have the time to go and visit doctors. So the idea behind this is to bring services to the farmers, get their blood pressure checked, be signposted to their GP for any serious concerns.
I'm always hopeful. I have a great team, and they are absolutely so proactive, and they will make anything work, but we can't do it on our own. And I think that's the thing that we need to really get across here, is this is about partnership working, but we have to listen to each other. We have to listen to each other's learnings. I'm not from a farming background, and I've learned so much over the last 3 years, but that's because I listen, I take on board, I learn, and I think that's what the team do all the time, and they're sharing the insight intelligence. So I'm really hopeful. I think we can really make something change and work.